subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. It was World Cancer Day on February 4th. And every year for the last few years, we've been doing a special session on cancer around this day. And today we have great pleasure in welcoming Dr. Sachin Almel, who's consultant oncology at the PD National Hospital and Medical Research Center at Khar in Mumbai. Before I welcome him, I'm going to introduce him. Dr. Sachin Almel is a very senior medical oncologist. He has passed his MD in general medicine from the Government Medical College in Surat and has done his DM in medical oncology from the Gujarat Cancer and Research Institute in Ahmedabad. He was a fellow under the aegis of the Varoon Mahajan Memorial Trust at the Memorial Sloan Kettering Cancer Center in New York. Welcome to Dr. Sachin Almel. How are you, doctor?
I'm great. Thank you for that kind introduction.
Today we have invited you, doctor, to speak about improving quality of life for older adults with cancer. And, it's a topic which concerns a whole lot of people who are senior citizens. And without any further ado, I would welcome you to speak. And then to all of you here, as always, please post your questions on the chat, and I will address these questions to doctor after the session is over. Do remember, this presentation is the presentation the doctor is going to be making is being recorded, and it will be there on our website on Monday evening, so you can check it at that time. And please follow the conversation, please follow the presentation, and then ask the questions. Over to you, doctor.
So good evening, guys. It's a great pleasure for me to kind of address the general population on this very, very important aspect of cancer treatment. As we all know that the advances that have happened in the cancer medicine, or for that matter in medicine, we are getting to see that the average expectancy of life has significantly increased, and which is why now we are facing many patients in our OPD who are, you would say, would be in the elderly subgroup. We also think that now geriatric oncology, which is addressing the needs of elderly patients, is a big branch by itself. And that is why I thought that this was a great initiative to actually ask me to talk about this important aspect. So, as we all know, as the life expectancy is increasing, the incidence of cancer is also increasing. It has become fairly common in the older adults. Treatment can generally be very difficult and challenging in this group of patients. It's not just treating the cancer alone which is important. We need to kind of be aware that just curing the disease alone doesn't suffice. We also need to always keep in mind that while doing the treatment, we're able to maintain a decent quality of life for all our patients, more so our elderly patients, where we always want to ensure that the person should feel physically, emotionally, and socially connected, and should not face a situation where he is becoming dependent on the society. And the very important aspect, the most important aspect of any cancer treatment would be controlling the pain, not just the pain, and also maintaining a good emotional well-being and staying connected with people around them. So why is it so important that quality of life should be addressed in elderly patients with cancer? We know, again, I may sound repetitive, but adults, older adults are now facing this cancer issue fairly commonly. And it is the focus of all the medical oncologists and all the treating oncologists to see to it that they are made to go through with the treatment fairly comfortably, and at the same time they should remain, they should themselves feel that they are still having a meaningful existence. So our focus should be in making them feel comfortable, happy, and supported throughout the treatment. And as I go through in the talk, I'll tell you how important it is also for the other caregivers in the family, they also play an important role in the entire management of the cancer patient in the elderly population. The cancer in the elderly people is typically, you know, uh, a problem. Not just the health, the cancer itself is one of the issues. The majority of these patients have multiple other comorbidities, and tackling these comorbidities is also one of the aspect. Majority of the patients which we would encounter in our practice would obviously will be patients of diabetes. They will be hypertensive. They would be having other issues. Maybe it is a second cancer for them, so they already have a baggage of the previous cancer which they faced in their lives, probably in their younger age when they were kind of fit enough to fight it. But now at this age, when they're old, to fight the disease again becomes a big challenge. Always in our practice, we tend to emphasize the fact that the treatment, the protocols which have been designed, have always been designed keeping the Western population in mind. There have been very few studies which have happened taking into account the Asian subpopulation. Now, things have changed, obviously, since last 10, 15 years. India, as well as the other Southeast Asian countries, have a phenomenal global presence now as far as trials are concerned. And therefore, we are getting data about Southeast Asian population as well as Indian population. And we are trying to customize the treatment to the needs of our subpopulation. So it is very imperative that the treatment be adjusted, not just only on basis of their age, but also we need to know what is the performance status. What do you mean by performance status? Performance status means what is the overall health status of the patient, whether he is bedridden, whether he is able to move around, carry out his own activities. All those kind of things matter. And when we factor in these things, then deciding on treatment becomes fairly simple. The approach has to be a holistic approach. I know a lot of this is a very cliched term, holistic cancer care. A lot of people, that those who must have spoken to you must have talked about holistic cancer care, but it is very important. We need to work as a team: the doctors, the nurses, the physical therapists, the psychotherapists, social workers. Each one of them has a major role to play. Also, it is very important that we need to adopt an approach which not just helps manage the symptoms of the patient, but we also need to improve the quality of life for the patients. So when we talk about the quality of life, very important is managing the physical health, encouraging the patients who are elderly to be very active, try to involve them in various physical activities. Here, the role of the physical therapist and also the local caregivers is they play a major role. We need to kind of emphasize that they should do yoga or maybe some other form of exercise. Simple walking exercise, going for walks also helps. I always kind of tell all my patients that some form of physical activity, whatever the patient is comfortable with, should be encouraged, and they should be asked to do it on a regular basis. Also, we focus a lot on minimizing the side effects from cancer treatments like fatigue, pain, nausea, vomiting, etc. But the one thing which everyone dreads, any patient with cancer dreads, or for that matter, even the doctors have a bit of a reservation in accepting this, but I do accept that pain has been the major symptom that most of our patients face, and living with pain is the most unwanted thing that one can have. and therefore alleviating this pain could be a major game changer for majority of these patients who are undergoing treatment. So it is our duty as medical professionals that we should address this pain aspect of cancer very aggressively. And it's very difficult to get the simple pain medications which are available over the counter is easy to procure, but these medications may not be very helpful in controlling the pain. They would need stronger drugs like morphine and pyragisate, and those kind of drugs which require prescriptions, and therefore we need to be at the beck and call of the patient and the their team of caregivers to manage the pain sufficiently enough. Another major symptom with any cancer treatment or for all those patients who are undergoing treatment is the fatigue. And managing fatigue is again very challenging as managing the pain. It is something which we always feel that we doctors somehow have not been able to kind of address this issue adequately. But yes, simple strategies, as I already mentioned: adequate resting, getting good sleep, prioritizing the task, what you want to do through the course of the day, manage your day, you maintain a diary that these are the things that I want to do during the course of the day, and prioritize those tasks. And simple exercises, as I already mentioned, simple like half an hour of simple walking, even within the house. Some of the patients may not be very comfortable going out because they may be unstable on their feet and may be worried about falling. And with thanks to the great roads that the BMC has, it always is a dangerous kind of proposition for elderly people to walk on these roads, and also the traffic issues and other issues, so pollution and all of that. The senior citizens always are very worried about these aspects, and I completely empathize with those issues. But despite that, I would say, yeah, you still would have a space. Maybe you walk in your own house, maybe you have a terrace, you can go there and maybe have a small walk, maybe 10-15 minutes. That keeps your mind active. It acts as a diversion from the current issues and makes it easier for you to go through with the treatment. We basically, another important side effect of all the therapies that we administer for cancer is nausea. And but having said that, nausea is now adequately managed. We have excellent drugs which can help in managing nausea. Majority of our patients are now nausea free because of these new medications. Loss of appetite again is a major issue, but I always tell all my patients that, look, get a diet chart from the dietitian and stick to that plan. Now, whether you are hungry, whether you're not, see that you have small frequent meals. Even if you are able to stick to the diet plan, the diet chart plan, even 70 to 80% of it, if you are able to do it, I think it is a good enough thing for you. And always have small frequent meals. Stay adequately hydrated. Again, this is another thing which I tell all my patients is at the beginning of the day, take a bottle of a liter of water, mix it with say maybe electoral powder or maybe Enerzal. These things are available commercially, and fill it and keep it as per the temperature that you want, room temperature or refrigerated, whatever. And throughout the day, keep sipping through that. This is a very healthy habit. You keep hydrating, not just hydrating, you're also having a good electrolyte balance within your body because you're consuming electrolytes along with the water. And that really helps because majority of the side effects like nausea, vomiting, if it happens, causes electrolyte imbalance. But if you're hydrating yourself well, it might help you in going through with the treatment comfortably. Now, maintaining physical activity has been the emphasis. You may be thinking that why am I emphasizing so much? Because physical activity not only keeps your mind in shape, it keeps your body in shape, and therefore it always is the key in keeping the energy levels up and preventing any further negativity that can creep into your mind. So gentle activities, walking, stretching, yoga, these are the things that I would recommend. There could be other issues, as I told you. Treating an elderly with cancer, we are not just treating the cancer alone. You are basically dealing with other health issues like diabetes, hypertension. Patient maybe cardiac patient must have had a transplant, or maybe a PTCA, which is by plasty, coronary angioplasty in the past. So we need to keep these things in mind also when we are devising the treatment plan for these patients, because many of our drugs, the chemotherapy drugs, could be cardiotoxic, and therefore we need to be very, very careful in identifying these patients before we start any treatment, and tailor cut the treatment or customize the treatment in a way that we don't jeopardize their previous ailments. And therefore it is very important that we know exactly which drug would be effective as well as friendly with the patient's previous condition. What we generally again face in our patients is, how are we going to manage their mental health and emotional well-being? This is probably the most difficult part. Whenever I get an elderly patient with cancer in my clinic, the first thing that they come and tell us is, look, we have lived our life. We don't want to suffer pain, and we want to kind of not do any further investigations, nor we want any treatment for this. And the diagnosis of cancer itself kind of depresses them. It is a very, very common finding in our society these days that the couple is staying alone here in India or Mumbai, whatever, and the children have flown the nest and they are staying abroad, and then the cancer comes in one of the elderly, one of the couple, and they are diagnosed with the cancer. This is the most difficult part now, because the children, they are very upset about the diagnosis. The parents here who are staying here, they are ill-equipped to handle the stress of the diagnosis, the stress of the treatment, the stress of traveling to the hospital every day for the treatment, the side effect management. All of that becomes a very stressful thing for them. And so majority of these patients feel that rather than doing the treatment, probably not do anything and embrace the eventual outcome. But my feeling here is slightly different. My philosophy is different. I would rather want to counsel them. I would tell them that, just it's not so easy to not do any treatment and pass away comfortably, because it wouldn't happen so, because you would suffer the pain and the other associated symptoms of cancer. And therefore, treating cancer also sometimes is necessary, even if you are not curing the disease, but treating the disease itself may bring down the symptoms to some extent or to a manageable extent, and that probably would translate into a better quality of life for the patient as long as they are alive. So it is very important to kind of keep counseling them, telling them that, look, even if you don't have enough support here, we are here to help you out. There are a lot of non-governmental organizations which look into these kind of patients. They sort of provide social support, and that is very important. And that, as a whole, we are trying to not only address their anxiety or their depression about the treatment and the diagnosis, but also we're trying to make their mental health robust so that they can go through with this treatment. Yeah. So basically, in our team, we always see to it that we have a counselor, a social worker, and also a psychiatrist addressing not the mental health. Physical health, we are looking after it anyways, but it is also equally important for us to look at the mental health. So what are the three major domains of social support in cancer management. The three major domains, obviously, as I mentioned, the emotional support, which will come from the family. This generally in our society is not a major problem because we have good enough family support. We extended family. We have well-wishers, friends. So emotional support generally is not too much of a problem, barring the scenario which I told you where the couple is staying all alone and the children are not here. So besides that, I think most of the other aspects of emotional support are generally managed. And it's also important for everyone to kind of the patient and the caregivers to keep sharing with the treating physician the information, whatever they can provide us with, whether the patient is facing a lot of anxiety, depression, stress. All of that should be conveyed to the treating doctor, so that makes life fairly simpler for the treating physician. And also, time to time, social media has always been a great support. In majority of these situations, we always encourage them to be part of certain support groups. They basically help in, they can voice their opinions, they can ask questions about various things which are pertaining to their treatment as well as their diagnosis. I sometimes feel that if something is conveyed to them by a fellow patient who is undergoing the treatment, it hits the right spot in the patient rather than a doctor or a counselor or a caregiver telling them the same things. So I think it makes a whole lot of difference in encouraging them to be a part of such social groups. As I have constantly been telling, that communication is very important. Again, majority of the elderly patients, they bottle up their emotions. They basically are not very forthcoming in telling us what is happening with them, because they don't want to burden their immediate family with their problems. That is one major drawback which these elderly patients always have. But we need to get them out of it, and we need to tell them that any communication with their doctors, family and caregivers is very welcome. In fact, that helps us in, again, customizing the therapy for them. We then come to know what is actually the cause for their depression or the anxiety, and maybe we can address that. So it is very important for them to know that communicating with your physician, communicating with your family is only the way by which you can come out of your ailment. It will help in you getting better and also achieving a good quality of life. So this is again which is coming up in a big way in the Western world. This has always been there. Support groups and peer support, like people who have finished their treatment and have gone back to their normal kind of life, they are part of this group, and they basically can inspire the people who are undergoing treatment to go through with it and fight the disease. And their advice always is very comforting, and it always is very helpful for the patients who are currently undergoing treatment to be a part of this. Also, as I mentioned, we also at Hinduja have these support groups. As I speak today, there is a support group program happening at Mahim, Hinduja, which is, we have a support group called Mehek, and which basically started off as a support group for the breast cancer patients, but now all patients are welcome to be a part of the Mehek group. And this really is a forum where people once in 6 months or once in 3 months, depending on how well they are gelling with each other, they can have a get together. We typically arrange for this get together in the hospital so that they can come and talk about their journey. Those who have finished their treatment and those who are undergoing treatment, they can sound their concerns regarding the therapy. Also, this is a place where little bit of the doctors also get some kind of input, because some of the patients then tell us that, okay, the doctors have not been able to spend much time with them, have not been able to exactly explain the kind of side effect management, or have not been adequately been able to address the pain issues. So it is an eye opener for the doctors also. So we also tend to be a part of the the group, but we are not in the forefront. We probably prefer to be like the flies on the wall. We are not seen during these meetings, but we are definitely getting what the overall undercurrent is. This helps us also in a way to plan the future therapies in the patient. Generally talk about a lot of advances happening in the cancer treatment. I don't think that is very, very essential when you are talking about when you are dealing with patients who are elderly. For them, extending their life with a meaningful existence and a good quality of life is all that they want. Majority of them, as I told you, many of them don't want the treatment. So you need to kind of tell them that this treatment needs to be done not to cure the disease, but at least to make it as a chronic disease so that you can live with it comfortably. And also important is majority of these patients will ask the doctor, how is it going to end? I mean, would I be in severe pain? Would it be difficult for my family to manage me when the end comes? So these are the questions which they have in their mind, which probably makes them more anxious, more depressed. You need to kind of alleviate those anxious feelings by telling them, look, for everything there is a way out. For pain, you have good pain management. For support at home, there are good NGOs and a lot of palliative care consultants who are offering their services all over Mumbai. And like we have them on our speed dial, so we can always get in touch with them to sort of also they liaise between the patient and the treating physician, so things become fairly well managed, and they can be even the end part of the disease also can be taken care of in a very, very sophisticated manner, dignified manner. The whole thing now changes over to how we are going to manage patients who are terminally ill. Now, there comes a time when majority of these cancer patients in them, the physician decides that probably there is no further treatment that can happen, not only because the patient is not tolerating the treatment, but also because in some of the cases, the disease has started progressing and is not responding to the multiple lines of treatment. When we reach that kind of a stage, we start talking to them about how one can take care, how the palliative care can be offered. Now, as I already mentioned, there are palliative care units, palliative care consultants who are moving all around in Mumbai. They do home care, home-based care. There are certain organizations which can even set up an ICU-like setup at home, and the patient can be managed in a very dignified manner at home as well. So palliative care is an important aspect of any cancer treatment, and we need to kind of keep that in mind and keep telling the patient that this, even if we reach a stage where the disease is no longer amenable to treatment, we still can make it very comfortable. The end can be fairly peaceful. So also, there are certain new centers like hospice centers which have come up in Mumbai, in and around Mumbai. Obviously, space constraint has always been the bane of Mumbai residents. So we may not have good hospice centers in Mumbai, barring the Shanti Avedna Ashram. But there are few new ones which have come up, and there are new ones which are in and around Mumbai. So these centers provide end-of-life support, and it makes the transition fairly simple, not only for the patient, but also for their families. So nutrition is another aspect which majority of the cancer have questions about. The simple thing that I can convey to everyone is that the easiest thing that one can think of as far as nutrition is concerned. That is, keep eating well. Whatever little you can have. I generally don't have any dietary restriction for any of my patients. I tell them that you can have everything, but the bottom line is you should have small frequent meals, because majority of you would not be having adequate appetite. So I generally tell them that it is better that you have small frequent meals. It doesn't matter what you eat, but keep eating. Now, again, there is another question which a lot of my patients ask is about many fad diets are available. Like, I won't name those diets, but everyone is aware of those diets. I sometimes feel that those diets, rather than making the person happy, they make them more depressed, because they don't allow you to eat what you want. And that makes life even more miserable, because any which ways the appetite is low, you're not able to eat much, and there you still have those restrictions imposed on you. So keeping that in mind, I always tell my patients there is no dietary restriction. I would just want you to have whatever you feel like. As I mentioned earlier, right at the beginning of the talk, geriatric oncology has become a very, very important aspect of oncology practice, and it is an amalgamation of not just the geriatric medicine, general medicine. It is oncology also is a part of it, and palliative care is an important part of it. So it is very important we address the geriatric syndromes. We always know that these patients are multiple drugs. Polypharmacy is a major problem in these patients. So it is important for the physician to know that there are a lot of interactions with the drugs that they are already on. So it becomes very necessary for us to customize the treatment. And also, it's not just the control of the cancer, but it is very important that we control their symptoms and give quality life. Hydration, as I have already said, hydration is something which is very, very important. Majority of our drugs, we want them to be excreted fast. And for that, we always insist that maintain adequate hydration. You should not get dehydrated, because many of these patients are also having a problem of vomiting with the chemotherapy drugs. Although we try and prevent the nausea and vomiting with many other drugs, but still it is a problem. So we say that if you're vomiting a lot, see that you hydrate yourself well. And also, whatever physical changes happen in your body, you need to kind of adjust to it. Hair loss, something which is very, very important and very, very stressful for the women who are undergoing treatment. So either you kind of tell them that you need to accept this, use a scarf or a wig, or there are certain new things which have come up, like using a scalp cooling cap, which is available in majority of the treating centers. So you can use this while you're doing the treatment. That really can prevent hair loss in some small percentage of patients. But yes, a lot of our patients are asking for it now. And we fortunately, both at Khar and Mahim, we have this facility available. Most importantly, you need to tell these patients that even if you're losing hair, even if there is a loss of limb or an organ, you still need to accept that, and should be encouraged to, the caregivers and the doctors need to encourage them to face life, face people and life in a confident way. Because everything boils down to how confident you are in facing these challenges and adjusting to the physical changes. Very important. Sleep is very necessary. We are very liberal in using sedatives in our patients. Whenever a patient tells me that, look, I'm not getting proper sleep, I would be more than happy to kind of give them good sedative so that they have a peaceful sleep every night, because it is vital for recovery of the body and also for a good mental well-being. Avoid caffeine, exercise, and avoid seeing screen. The screen time should be minimized before you go to sleep, because that probably interferes with your sleep pattern, and which is why this is a advice practically for all, not just people who are undergoing cancer treatment. It is an advice to everybody if you minimize the screen time, I think that always helps in giving you good sleep. This was the question which was asked by some participant, that yes, many of the drugs also contribute to these cognitive changes, like peripheral neuropathy is a major side effect of many of the drugs. And also memory loss, yes, probably it is a combination of both. Aging, coping with cognitive changes was lost anyways. So for to cope with these cognitive changes, again, exercise, good sleep, calm environment, good emotional support from the family. These are the things which would help. Memory loss is something which obviously could be a combination of not just the drugs, but also at that age, losing memory is something which is not very, very uncommon. So these are challenges which we face, but we tend to ask them to, play simple games like computer games, or, solving a crossword, or trying to do a Sudoku puzzle or some such thing that keeps them active, the mentally active, and that helps in avoiding the memory loss and getting the memory better. And also, this I don't need to kind of emphasize. Many of our senior citizens are aware of this. They are very, very well connected. They know how to use the technology to stay connected, and everyone is kind of doing that. They're calling their family through video calls. They are connected to the social media, and they are Googling things about what they are undergoing. But all of this is fine to kind of keep you connected with what is happening around you. But at the same time, I think it is important for you to bring forth whatever your concerns are with your treating physician, not just rely on the social media to give you the answers. Always a person, get in touch with a person who is an expert in these areas, whose advice probably would be better than what you are getting through the social media. And also, there are multiple simple apps, applications which are available, which help you track your own therapies. They tend, like a lot of patients come and tell me that, I skipped my medicine yesterday. Is that going to create a problem, and all of that? So I tell them, look, skipping the drug for a day doesn't really make a huge difference. But having said that, it should not become a habit. And which is why, falling back on these apps helps, and you're able to kind of keep a track of what medication needs to be taken and at what time. The most important aspect. Unfortunately, all the cancer therapies which are available, the newer ones, I would say, like the targeted therapies, the CAR T cell therapy, the immunotherapy, all of these therapies, though very, very exciting for an oncologist because they are showing excellent results, at the same time, they're extremely expensive, completely out of reach of the common man. So with the help from the parent companies, and also with help from the government, we basically are getting many of these drugs at very subsidized rates. Also, it's been a great thing which is being done by the pharma industry. They support the patients. They have programs which are called as patient assistance programs, in which they are giving certain therapies free. So this really helps in not only the cancer physician, because he can offer these treatment. He knows that this disease can be treated well with immunotherapy. And fortunately, with these programs, they are able to offer that to a larger population of patients. But still, this remains a major drawback as far as cancer treatment is concerned. Majority of these drugs are very expensive. We all are working towards it. The oncology consultants all over the country, they tend to kind of keep talking to their respective governments, telling them that these are the things which need to be looked into. And fortunately, yes, some of the drugs which really have made a difference are getting cheaper. So that is one thing which we can look into. Also, we always, like at our hospital, there are some patients who tend to, I don't know, but the people should who are participating today should know that Hinduja Hospital is also charitable hospital too, to some extent. Like only 20% of the beds which are there at Mahim are considered to be charitable beds. So we get a lot of patients traveling from remote areas of Maharashtra coming to Mahim for treatment. And fortunately, because of this charity which the hospital does, we've been able to give them the best of care, the latest treatment, and many of them have been doing very well. And herein also, I would like to highlight one fact is the fact that we have a group of social workers who help us. And many of these patients, what happens is after you have done a particular part of the treatment, once they go back to their remote places, they don't come back. And then once they again come back, the disease has again recurred, and then it becomes difficult to manage them. So these social workers have been very helpful in the sense they provide accommodations in and around Mahim at very, very subsidized rates, which helps in housing these people. Also, they look into their transportation to the hospital, and that makes their treatment fairly simple. And it is our responsibility that we see to it that the treatment gets completed. So this is another good thing which we have been practicing at our hospital. As I said, it's always the diagnosis is overwhelming. And it is important that you need to communicate that with someone. If you are close with someone in your family or your friend or someone, you need to discuss it with them. If you don't have anybody, then reach out to the medical professionals. We would be more than happy to help you. Also, if after having done the medical consult, you still want help, you always can fall back on the many support groups which are available through the city. And as I always mention, that India is blessed to have a very strong family support, and which majority of the patients can fall back on to deal with this dreaded disease and come out of it with flying colors. It's not only important to treat the cancer in elderly. Yes, a lot of our patients are elderly. And as I already mentioned, with improvement in the therapies for the other diseases, cancer is now getting diagnosed more and more in patients who are above 60. And therefore, this is a major area which we are encountering in our day-to-day practice. Just treating the disease and trying to just cure the disease should not be our only goal. I would always feel that looking into their emotional aspect, mental health is also equally important. And more important is the fact that you do the treatment, but at the same time, see that the patient is able to maintain a decent quality of life. Eventually, that's what any patient would want, and more so the elderly patient.
Thank you very much, Doctor, for an excellent presentation. There are so many questions that have come in, but I'm going to just restrict it to the questions that are relevant to this topic today. So all of you here, we are going to be recording the questions, and we will ensure that they are addressed in some form or the other in the next few weeks. Dr. Sachin, very good presentation. Thank you very much. One thing which I wanted to mention to you is that we have a lot of people who are not from Mumbai, who are from other cities. What is the availability of palliative care and advisory services in smaller cities? For instance, people may be in Mumbai, but what about, say, in a place like, say, Kalyan, or they may be in Bombay and Pune, but in Satara, in Kolhapur, or other cities? What is the availability?
So you're right. I mean, the tier 2 cities, or maybe the smaller cities like Kolhapur and others, may not be having the palliative care setups. But there are a lot of treating oncophysicians or medical oncologists who are basically dealing with palliative care. And in their own setup, like for example, you talked about Kolhapur. So Kolhapur, there is a big hospital which is run by Dr. Suraj Pawar, which is a big place, and he has a separate cell which caters to these kind of patients. And also, like you talked about Kalyan. Now Kalyan, yes, you may not have something available in Kalyan itself. But yes, there are a couple of centers which are very closer to Kalyan, like Badlapur. There is one hospice closer to Badlapur. Then in Pune, there is one which is run by Cipla. In Mumbai, also, I told you, in Mumbai, because of space constraint, we don't have too many, but we can always go to refer these patients to these peripheral centers.
Right. I must mention here that we are going to be doing a session on palliative care. We've had a few sessions on palliative care in the past. Doctor, we've had Dr. Raja Mayer, who's also associated with Hinduja, who's conducted a session. We've also had Dr. Eric Burgess, who runs a palliative care center, which is, of course, not for cancer, but we are planning to do a session on this. There are a few questions that have come in, which I'm going to take, which are concerning the topic here. This is from Shamla Ravi. Is it advisable to treat a 70-year-old with chemo if the disease is spreading fast? And how effective is stem cell therapy or immunotherapy?
Now, again, this is a very, very sort of general question. Depends on what disease you're talking about. Now, for example, if it is, say, a pancreatic cancer, which has spread to the liver and to the bones and extensively spread in a 70-year-old, yes, in that age group, probably I would not be very, very keen to go ahead with aggressive management. I probably would be more concerned about maintaining a decent quality and a pain-free life. So in that, I would just do palliative care. But if you have a patient who has significant disease burden, like and the diagnosis is that of a say what do you call it? Lymphoma. In lymphoma, I would definitely be very keen to get it treated, because lymphoma is typically considered to be a curable disease, and we can definitely customize the treatment for a 70-year-old in a way that they can tolerate the treatment and at the same time achieve a cure for the disease.
We have a question from Mr. Syed Rizwan Haidar. It's a very general question, but full body checkup kab karana chahiye? When should he get a full body checkup done? I'm assuming that he doesn't have there are no symptoms of cancer which are there, but how does one ensure that you don't have cancer in the body?
So I think he's talking about how often or who should go for a screening program or a routine health checkup, right? Now, routine health checkup for different reasons is recommended once a year. Maybe you probably should get your cholesterols and BPs and cardiac enzymes and all of those checked. That is a different ballgame. But if you are talking about health checkups with cancer in mind, then I don't think it should be offered to everybody. Like, I would always suggest that, like, a lot of health checkup programs have, tumor markers which are done, and they do a lot of other tests which basically put the scare of cancer in you, but actually are not helping us in any big way in diagnosing a cancer. The only three or four screening programs which are kind of really helpful is getting a mammogram done for women who are more than 40 years old, maybe once in 2 years, once in 3 years for them. And those who have a very strong family history of breast cancer in them, then maybe yes, in them we probably might do it once a year. Doing a fecal occult blood test to kind of screen for colon cancer is something which we recommend only if there has been a strong family history of colon cancer in the family. And the third thing, for men, we suggest that they should start getting a PSA and a digital rectal examination done after they cross the age of 50. Again, if there is a strong suspicion of cancer in the family. But otherwise, randomly asking them to go for health checks for cancer screening is something which is not really recommended.
Right. Thank you very much, Dr. Sachin Almel, for this session. I know there are quite a few questions that have come in, but as I mentioned, we will do a couple of more sessions for one on palliative care and one on some of the questions that you once asked over here. Dr. Sachin Almel, is there any last word of advice that you would like to give to our senior citizens about cancer care, and in case they do hear of themselves or somebody around them who has got cancer, what is the first word of advice that you would like to give somebody like that?
So my first word of advice for everybody, not just the elderly people, but also the people in general about cancer is cancer no longer is considered to be a death sentence. You have to understand that there are so many good treatments available. So you should always be looking at it with a different perspective. Try to understand that you can fight this disease and come out of it. There are so many success stories. So you should not just get depressed about the diagnosis. You should try and fight the disease. And together, if we fight the disease, we can conquer this disease. And there are so many new things which are coming up, which truly excites any medical oncologist or for that matter, an oncologist, because we see that this would translate into better cures, better quality of life for all our cancer patients.
On that note, thank you very much, Dr. Sachin Almel, for this session. Thank you to the team at Hinduja Hospital for facilitate this. And we will of course keep coming to medical oncologists like yourself for our senior citizens, for advice, for words of guidance like these on a regular basis. Thank you very much, Doctor.
Thank you. Pleasure is totally mine.
Yeah. Thank you. Yeah.
Subscribe now and press the bell icon. Never miss an update.